Hello, my name is Jolene Castro, and today I am creating this recording for remediation of an insertion of a Foley catheter on a female patient today. I've gathered my supplies. I have my patient who is covered, I have my Foley catheter kit, I have some clean washcloths, my hand sanitizer, and some clean gloves. For remediation of this video, it will begin after cleansing the perineal area. Therefore, before entering the patient's room, I have performed hand hygiene and checked for patient safety. I have knocked on my patient's door, entered the room, closed the door behind me for patient privacy. I have introduced myself and let the patient know that the doctor has ordered an insertion for a Foley catheter to be placed today. I have obtained two patient identifiers. I have checked for allergies. I have let my patient know I have explained the procedure to my patient and the duration of time for how long the procedure will take. I have obtained consent. After obtaining consent, I have placed my patient in the recumbent position. I am on her dominant side, and I have performed hand hygiene and put on some clean gloves. I have placed a pad under my patient, and I have cleansed the area. Cleansing the area, I have obtained clean washcloths. The first one with soap and water, starting with the furthest labia away from me, changing the corner, the closest labia, the labia closest to me, changing the corner down the middle. I will discard of the washcloth, obtain a new washcloth with just water for rinsing. I will start with the furthest labia away from me, changing the corner, closest labia closest to me, changing the corner down the middle. I will do the same procedure, patting dry, with the furthest labia, closest labia, and down the middle. Now that my patient is exposed and cleansed, I will be checking for skin integrity. I will be checking for any redness, any irritation, any inflammation, any discharge. After checking for skin integrity, I'm also identifying the urinary meatus. After identifying the urinary meatus, I am disposing of my gloves, redoing hand hygiene, and obtaining my Foley catheter kit. I'm going to discard of the packaging and open the kit with the fold furthest away from me, and the two sides and down the middle. After that, I'm going to obtain my sterile gloves. After obtaining my sterile gloves, I'm making sure that I'm maintaining my 1-inch border. And in order to put on my sterile gloves, I'm going to be starting with my dominant hand, only grabbing the cuff of the glove. Making sure that I am maintaining the cuff all the way around, as well as keeping my hands above my waist. After placing the gloves and maintaining the cuff all the way around, I'm going to be using my 2 fingers to cuff my non-dominant sterile glove and place that on my hand. So I'm going to be cuffing the glove, still maintaining above the waist, and the cuff all the way around. After maintaining the cuff all the way around, I am going to be discarding of the packaging that my sterile gloves came in. I'm going to be grabbing the drape, shiny side down. I'm going to be asking the patient if she can lift her hips. I'm going to be placing the drape under her. I'm going to grab my fenestrated drape and place that over my patient. I'm going to be grabbing the cotton swabs and removing of that. I'm going to be placing some lube down and discarding of that. I'm also going to be placing my syringe on my Foley catheter. After that has been placed, I'm going to be removing my catheter from its sleeve and discarding of that, placing it in some lube. Now that has been placed, I'm going to let my patient know, okay, ma'am, I'm going to be starting the procedure, and noting that once my non-dominant hand is placed on the patient, it does not move from the field to avoid any contamination of the sterile field. I'm also going to ask that my patient do not move, also to prevent contamination. Ma'am, if I'm going to begin the procedure, try not to move. You may feel a little bit of discomfort. If you want, feel free to bear down. It should help a little bit with the discomfort. So now placing the hand on my patient, I'm going to be grabbing the urinary Foley catheter and placing the catheter inside the urinary meatus. I'm going to be inserting it 3 to 4 inches. After seeing urine expel, I'm going to be inserting it another 1 to 2 inches. After that has been placed, I'm going to grab my Foley and insert the balloon, or fill the balloon. After that, I'm going to discard of the syringe. I'm going to tug a little bit, make sure the placement is correct. I'm going to secure the Foley to my patient below the bifurcation to make sure that the Foley does not become removed. I'm also, after securing it to my patient, I'm going to grab my Foley catheter. And now that the urine is going inside my Foley catheter, I'm going to assess it. I'm going to check for output. I'm going to check for any cloudiness. I'm going to check for consistency and color. After checking for that, I'm going to be placing the Foley catheter on under the bladder and on the mattress of my patient's bed. After that has been placed, I am going to remove of any materials and cleanse my patient one more time before remove materials and cleanse the patient one more time before leaving the room. After discarding of materials and removing my gloves, I'm going to ask my patient if she has any questions. I'm going to ask if she's comfortable. If not, I'm going to be repositioning her. After repositioning her, I'm going to place the call light by her and see if she has any questions. If she doesn't have any questions, I'm going to leave the call light by her and let her know that if anything does come up or she needs anything, to please press the call light and let me know. I will redo hand hygiene and perform documentation. Thank you.